Maybe I'm an optimist, but I think if it's Canadian and it's people in BC, we want to do the right thing. We believe in our communities where it's in our nature to support each other through these things. And my experience through my colleagues who are managing this in the day-to-day basis, so people who have this disease and people who are in quarantine are being contacted. And everybody, for the most part, wants to do the right thing. And if we give them the means to do it, they're able to do the right thing. And this is where it's so important that we as a community support people. You know, people are coming back and they're thinking, well, how am I going to get groceries? What am I going to do? So this is where we need to reach out to people and not be afraid to reach out and ask for help as well. Because if you are in quarantine, you should not be going to the grocery store. You should not be going to the pharmacy. So we need to support you in being able to do that because it protects all of us. I've also had, you know, many people who've worried about their pets, and there's ways that we can support them in walking their dogs. Though I must say, there's a lot of very happy pets around these days because I think there's so many people at home with them. So I do believe that most people are doing the right thing. I think the messages they get when they come into the country sometimes need to be beefed up. And that I've heard from many people, oh, I wasn't really told that I couldn't do this or I couldn't do that. So that is something that we are working with the federal government on to make it crystal clear for people that if you are in quarantine, it means you're a risk for having this disease, and we don't want you to pass it on, nor do we, most people, want to pass it on to anybody else. And these are the things that you need to do now.
I mean, we heard in one of the earlier questions about someone who had had a procedure canceled. There are lots of people that have had to make extraordinary sacrifices in their lives. I've heard from many of them. And so what we saw when we presented data last week, what we see in the community is people absolutely following Dr. Henry's orders. We see it in the number of people on transit. We see it in the number of people on ferries. We see it in the number of people driving around. We see that people are following. What we're saying, though, is that our success in the coming weeks in limiting the growth of COVID-19 in BC will depend on all of us. And so this is a message we have to deliver every day. I thought the Premier did that in a very clear and necessary way last night, but it's a message you're going to hear us reinforce every day. With respect to people coming back to Canada, who are returning to Canada, whether it's on government-sponsored flights or commercial flights that the government has helped to arrange, I simply say that we have to ensure that that message is delivered for their sake, but also for the sake of the entire community. I'll just give you a very simple example. There will be cruise ships that are going to be where people are going to come back to Canada in the coming days, and the Prime Minister referred to this, and I know, and I mean this with absolute support for the efforts being made by Global Affairs Canada in helping people. But the Herculean task doesn't end when people arrive in Canada. It only begins. And significantly in previous cases, for example, with respect to cruise ships, the Diamond Princess and I think the Grand Princess, which you'll remember was off the coast of California, people were taken back and in quarantine. Well, if that is not to be the case now, and they were brought to Trenton or they were brought to Cornwall and they were in quarantine, and there was very clear circumstances there, if it's the case that we're saying that they can return to the community, then that message has to be so clearly delivered and in such a way upon arrival and throughout the trip that there can be no misunderstanding. We need everybody involved, and our ability to bend the curve depends on that. It is an inspiring thing to see people, what people have done in the last few weeks in BC. It is inspiring. I am proud to be someone from British Columbia and see the community respond this way. But can't be 80%, can't be 85%, it's got to be 100% if we're going to do what we need to do to support our healthcare workers, to speak to all those people who had their surgeries canceled and say, this was an enormous sacrifice, but something happened here that the whole community got behind, and that people are with you in your struggle. To do that, we need everyone to be on board, and that's the message the Premier delivered last night, and that's the message I expect we'll be delivering every single day.